Before I started...
Stop. Okay.
Before I started my head-to-toe assessment, I did obtain Miss McDowell's vital signs. Her height and her weight were all within normal limits. I observed her as she walked in. She does have a steady gait. She is alert and oriented and dressed appropriately for the weather. And I did obtain her results from the Snellen chart test, and her vision is 20/30 vision. So what she's seen at 20 feet away is what a normal person can see from 30 feet away. So now we're going to start her head-to-toe assessment. Hi, how are you? My name is Amanda, and I'll be your student nurse for today, okay? Well, today we're going to do a head-to-toe assessment, and it shouldn't take us that long, so we'll be out of here soon, okay? Well, first I'm just going to inspect you generally. Do you have any tattoos or piercings?
No.
Okay, and I am observing your skin, and your skin is smooth and even for your genetic background. So first I'm going to feel for your temperature. Okay, it is warm to touch, and I'm going to do a capillary refill test here. Okay, and your color did return back to your nose bag within 2 to 3 seconds, so that is good. Now I'm going to test your skin turgor. Okay, and your skin did return, so you do have good elasticity, and it lets me know that you are hydrated, okay? Now we're going to go ahead and move to your head, and I am just looking at it, and it's normal cephalic, so it means appropriate in size and round for your body size, so that's good. Now I'm going to go ahead and palpate your scalp. Let me know if you feel any pain, okay? I'm just feeling for lumps or lesions or any abnormalities. I don't feel anything. Do you feel any pain?
No.
Okay, good. Now we're going to go ahead and palpate your sinuses, so you can just remove your glasses for right now. Okay. These are your frontal sinuses. Do you feel any pain?
No.
Okay. You should feel pressure but no pain. And your maxillary sinuses, do you feel any pain?
No.
Okay, good. Now I'm going to go ahead and we're going to do a few exercises just to make sure that your cranial nerves are intact. So first I want you to smile for me. Frown for me. Okay, puff your cheeks out. Okay, good. Cranial nerve 7 is intact. I want you to resist my pressure. Clench your teeth and resist pressure. Good. Cranial nerve 5 is intact. Now I want you to close your eyes. I'm going to touch your face with something, and I want you to say now every time you feel it, okay?
No. 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 No.
Okay, good. Cranial nerve 5 is intact. I want you to say light, tight, dynamite.
Light, tight, dynamite.
Good. Cranial nerve 12 is intact. Okay, raise your eyebrows for me. Good. Cranial nerve 3 is intact, okay? Now I'm going to do a TMJ test. Put my gloves on. Okay, and just let me know if you feel any pain while I do this, okay? I just want you to open and close your mouth for me. Okay, did you feel any pain?
No.
Good, I didn't feel any popping or crepitation. Now we're going to go ahead and move to your ears. Well, first I'm going to do your mouth and your mouth and your nose. So I'm just looking at your lips, and they are even and symmetric in color for your genetic background, so that is good. Now I'm going to go ahead and take a look inside, okay? Okay, your buccal mucosa are pink and moist, hard and soft palate are pink and moist, pillars and posterior pharynx are pink and moist, your tonsils are present 2+, uvula is midline to the mouth. Say ah for me.
Ah.
Okay, the uvula and soft palate rose at the same time, so it lets me know that cranial nerve 10 is intact. I'm going to check your gag reflex. Okay, cranial nerve 9 is intact. I do see your Stenton's duct. Raise your tongue for me. Okay, the frenulum is midline to the tongue, and I do see your Warden's duct. You do have good oral hygiene, and your wisdom teeth are absent, okay? So that's good. Thank you. Okay, and now we're going to do a taste test, so I want you to tell me what you taste.
Salt.
Okay, good. Cranial nerve 12 is intact, okay? So now we're going to go ahead and move to your nose. I'm just looking at your nose, and it is midline to your face. I don't see any deviations or abnormalities. So now I'm going to go ahead and take a look inside, okay? Okay, just take a look inside. Okay, your nasal mucous membrane is normal, red, smooth, and moist. I don't see any bleeding or any excessive discharge or any bulging, so it does look good. Okay, thank you. And your nasal septums are not deviated, and your turbinates are in the same red color as the nasal mucous membrane, okay? Oh, and then now we're going to do a smell. I'm going to include one of your nostrils, and I want you to tell me what you smell, okay?
Alcohol. Okay. Alcohol.
Okay, good. Cranial nerve 1 is intact. Now I'm going to go ahead and move to your ears. I'm just going to go ahead and look at your ears, and I am just looking at them, making sure they are equal bilaterally, and I don't see any excess discharge or any redness. Okay, so now I'm going to go ahead and palpate your auricles. Tell me if you feel any pain. Okay, any pain?
No.
Okay, what about in your tragus?
No.
Okay, mastoid process?
No.
Okay, good. Now I'm going to go ahead and take a look inside your ear. Okay. Okay. And I have my cone of light in a 7 o'clock position in the left ear. And, okay, the tympanic membrane is a pearly, shiny gray color. I don't see any bulging, retraction, or any excess fluid. That's good. And I will repeat in the right ear, but my cone of light will be at a 5 o'clock position. Okay, now we're going to do a few tests. The first one is called a hearing test. I'm just going to stand behind you. I'm going to whisper something in your ear, and I need you to tell me what you heard, okay?
1, 2, 3.
And cover your ear for me while I do it on this side. That ear.
ABC.
Okay, good. Cranial nerve 8 is intact. Now I'm going to take this tuning fork, and I'm going to stimulate it and put it over your head. It's called a Weber's test, okay? And I want you to say now when you can't hear it anymore, okay?
No.
Okay. The next test is called a Rennie's test. I'm going to stimulate the tuning fork again, put it in front of your external ear canal, and then I'm going to put it on your mastoid process. And I want you to tell me when you can't hear it anymore, okay? Just say now when you can't hear it.
Now. 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 Now.
Good. So that does let me know that ear conduction was heard louder than bone conduction, okay? And that your cranial nerve 8 is intact. So that's good. Now we're going to go ahead and move down to your neck. Well, we're going to do your eyes first. And I'm just looking at your eyes and your eyelids. The skin of your eyelids are intact. I don't see any lesions or abnormalities. Your eyebrows are symmetric. Your eyelashes are evenly distributed. Your eyeballs are aligned normally inside of their sockets, so that's good, okay? Now I'm going to go ahead and just palpate in your lacrimal glands just to see if you have any pain. Any pain?
No.
Okay, what about around your eyes?
No.
Okay, good. Now we're going to do a few eye exams, eye tests. So the first one is called cover test. I'm going to take this card and I'm going to put it over your eye, each of your eyes. And I just want you to look ahead of me. I want you to look ahead of me and tell me, I'm looking for any deviations, okay? And I just want you to look straight ahead of me, okay? Okay, good. Good, okay, you did maintain a steady fixed gaze, so that is good. The next one is called a confrontation test. So I want you to hold one card up over your left eye while I hold this card up over my right eye. And I'm going to bring my finger inward towards you. And I want you to say now when you can see it, okay? And we're just testing your peripheral vision, okay? So go ahead and cover your eye.
No.
Okay? And move it together.
No.
Okay, good. You do have good peripheral vision. And I'm going to go ahead and check your conjunctiva because I did forget to do that. Okay, look up for me. Good. They are pink and moist and your sclera is china white. Okay, good. The next test is called a corneal light reflex test. I'm going to take this light, I'm going to shine it on your cornea, and I'm just trying to see if the light reflects off of your cornea in each spot on each of your eyes, okay? So just stare ahead for me again. Okay. Okay. The light did shine off of each of your corneas in the same exact spot, so that is good. That's what I was looking for. The next test is called a peripheral position diagnostic test. I'm going to move my fingers in a certain direction, and I want your eyes to follow, not your head, just your eyes, okay? So just follow my fingers. Okay. Good. Your eyes did move parallel to my parallel to one another, and it does let me know that cranial nerves 3, 4, and 6 are intact. So the last test is called a light reactive accommodation test. First, I'm going to bring my pen inward towards you, and I want your eyes to follow my pen as it go inward. I'm just trying to see if your pupils contract. constrict, and then I'm going to shine my light on your pupils and just trying to see if they constrict as well, okay? Follow my pen. Okay, your pupils did constrict. Now I'm going to go ahead and shine my light on your pupils. Okay, it did constrict. Okay, and it did constrict. Good. Now last, I'm going to go ahead and take a look inside your eye. Okay. Well, first I want you to cover this eye like this one. Okay. The red reflex is present. Retinal arteries and veins are visible. And I do see your optic disc, which is creamy yellow. Okay, thank you. And I will repeat it in the other, in her right eye. Okay, now I'm going to move down to your neck. I am just looking at your neck. Your trachea is midline to your neck. So now I'm just going to palpate and feel on your sternomastoid, your trapezius muscle and your sternomastoid muscles. Do you feel any tenderness?
No.
Okay, good. Now I'm going to feel for your lymph nodes. So you have your preauricular, posterior auricular, occipital, submental, submandibular, tonsillars, superficial cervical, deep cervical chain, posterior cervical, and supraclavicular. Okay, good. Now I'm going to come behind you and feel for your thyroid tissue, and I just want you to hold your head down and to the right and swallow for me, okay? Down and to the right. Okay, now to the left. Okay. The thyroid tissue did move up as you swallowed, and I didn't feel any enlargement, so that is good. Now I'm going to feel for your carotid artery, just the pulse. Okay, it is a moderate beat, and it's 2+, which is normal. Okay, a moderate beat, and it is 2+. Now I'm going to go ahead and listen for any bruits in the carotid artery. Okay. I didn't hear any bruits present, so that is good. Now we're going to go ahead and move on to your chest sounds, okay? Okay, so first I'm going to listen at your aortic valve, which is on the right sternal border, second intercostal space. Okay. Okay, now we're at your pulmonic valve, which is on the left sternal border, second intercostal space. Okay. The tricuspid valve, which is on the left sternal border, third intercostal space. Okay, I have to come up and show a little bit. Okay. I'm at your mitral valve, the midclavicular line, fifth intercostal space. Okay, good. I didn't hear any murmurs, and S1 and S2 were present. S1 was her louder at the apex, and S2 was her louder at the base. So now I'm going to go ahead and listen to your lung sounds. Well, first I'm just going to observe your thorax. It is symmetric. Your scapula is symmetric. You are maintaining a relaxed posture, and your skin is even and consistent with your genetic background. So now I'm going to go ahead and listen to your breath sounds. First, we're going to start at the bronchial, which is at near the trachea. Okay, and it is high-pitched and loud is what I was looking for. Now at the bronchovesicular, which is moderate. Okay, and your vesicular, which is low-pitched and soft. Okay, now I'm going to listen to these same sounds in the back, okay? Now I'm listening to your bronchovesicular, which is on the spinal column, and they are moderate in sound. Okay, I have to go up your shirt a little bit. Listen for your vesicular sounds, which is coming off of your scapula over to your thorax, and they are low and soft in sound. Okay, good. Okay, so that completes our when I also take for your breath sounds and your heart sounds. So now we're going to go ahead and move on to your abdomen. So I'm going to have you lay down for me. Okay. Thank you. And you can lay your feet flat and just relax. Okay, let me put this out. There you go. But first, I'm just going to inspect and Look at your abdomen. It is flat, and your color is consistent with your genetic background, and you do have an inverted umbilicus, okay? So now first I'm just going to go ahead and auscultate for vowel sounds, okay? And I'm going to start at the right lower quadrant. Okay. Okay. Vowel sounds were present. Now I'm going to listen for your vovular sounds, okay? Just to see if I hear any bruits, okay? Okay, so we're going to start at the aortic artery. Then we're going to move down to the left renal artery. Okay, then to the iliac artery. Okay. I didn't hear any bruits, so that's good. Now I'm going to go ahead and percuss your abdomen, okay? I'm going to start at the right lower quadrant. Okay, I did feel general tympany throughout, and I did feel a little dullness at the right upper quadrant, but that's because of your liver that's present. So now I'm going to go ahead and palpate just to feel for any lumps or masses or distension. Okay. Okay, I don't feel any masses or lumps present, but I did feel dullness at the right upper quadrant because of your liver that's there. And now I'm going to deep palpate. Let me know if you feel any pain, okay? Okay, so I did feel dullness again at the right upper quadrant because of the liver, and then the left upper quadrant because of the spleen. Okay, so we're done with that. Okay, you can sit up now. Now I'm going to do a costovertebral tenderness test, and we're just feeling for your kidney. You shouldn't feel any pain here, okay? Okay, now I'm going to do a tactile femoris test. I want you to say 99 as I move my hands down your back, okay? I'm just trying to see if I feel vibrations throughout.
99, 99, 99.
Okay, and I did feel vibrations throughout symmetrically. So now I'm going to go ahead and percuss your back, and I'm just feeling for resonance, okay? Okay, and I did feel resonance throughout, so that is good. So now I'm going to take your pulse while you're just sitting here and you're relaxed. It's your radial pulse, okay? Okay, your brachial pulse. Dorsalis pedis pulse. Okay. And your posterior tibial pulse, okay? And they were all 2+, so that lets me know that it is normal. Okay, you can hold your feet over down. Okay, now we're going to go ahead and do some exercises. Well, first I just want you to hold your arms up and just testing your upper body strength. So hold your arms up. Pull against me. Now push against me. Okay, now for your legs, I want you to do the same thing. Pull against me. Push against me. Okay, good. You do have equal upper and body strength. They are equal bilaterally. So now I want you to go ahead and stand up while we do a few range of motion exercises. You can just stand right on this side. Okay, first I want you to hold your head down, your neck down for flexion. Hold it back up for extension. Lay it to the left for left lateral bend. Now to the right for right lateral bend. Okay, now for your arm, I want you to pull it away from your body for abduction and bring it back in for adduction, okay? In for abduction. Now bring it back in for adduction. Now doing a big circle for circumduction. Okay, did you feel any pain?
No.
Okay, didn't feel any popping or crepitation. Now I want you to hold your arm out. Okay, I want you to bend it for flexion. Bend it for flexion. Lay it back down for extension. Okay, now for your wrist, I want you to hold it downward for pronation. And hold it back up for supination. Did you feel any popping or crepitation or pain?
No.
Okay, I didn't feel any popping or crepitation. Now I want you to touch your toes for flexion. Okay, now come back up for extension. Lean to the left for left lateral bend. Now to the right for right lateral bend. Okay, did you feel any pain? Okay, I didn't feel any popping or crepitation. Now I want you to lift your knee for flexion. Lift it for flexion. Now bring it back down for extension. Okay, did you feel any pain?
No.
Okay, didn't feel any popping or crepitation. I want you to point your toe for plantar flexion. Point it for plantar flexion. And lean back on your heel for dorsiflexion. Okay, point your toe outward for eversion. Okay, and bring it back in for inversion. Okay, did you feel any pain?
No.
Okay, I didn't feel any popping or crepitation. Go ahead and sit down. And I will repeat all of the range of motion exercises that I did on her right side, on her left side. So you do have an active range of motion, so that's good. Now for our last few tests, I'm going to first test your reflexes. So first we're going to test your triceps. So okay, good. Now we're going to test your bicep reflexes. Okay. Now your patella. Now for your Achilles. Okay. Good. You do have a 2+ on your deep tendon reflexes, and I will do the same reflex test on her left side that I did on her right side. Now we're going to do a finger-to-finger test. I want you to touch your nose and then touch my finger, and we're just testing for your coordination, okay? Okay. 2 more spots. Okay. 1 more. Okay. You do have good coordination, and your movements were accurate and smooth. So now we're going to do a few. I want to place something in your hand. I want you to tell me what I placed in your hand. So go ahead and close your eyes. Okay.
G.
Okay, good. And that test was called stereognosis. Now I'm going to draw something in your hand. I want you to tell me what you felt. Okay, so close your eyes again.
8.
Okay, yes, it was number 8. So that was your sensory test, and that was called graphothesia. Now we're going to do 2 more exercises. I need you to stand up for me. Okay, the first one is called a tandem walk. I want you to take 4 steps forward, heel toe, and then come back the same way, okay? Okay, now come back. Okay, good. You did maintain your balance, and you did not fall off to the side. Now the last test is called Rembert's test. I want you to stand still, close your eyes for 20 seconds, okay? Okay, good. You did maintain your balance and you did not sway off to the side. So that does conclude our head-to-toe assessment. It was nice working with you. And I'm just going to check my chart and make sure I did do everything, okay? So you can go ahead and have a seat. Okay, I did not do my respiratory excursion test, so I'm going to come back here and I want you to take a deep breath in and out for me, okay? Go ahead. Okay, it was between 3 to 5 centimeters, so that is normal, okay? And one more test, I want you to raise your shoulders against my hands, okay, and turn your head against my hand. Good, okay? Cranial nerve 11 is intact. I'm sorry that we had to, redo that, but thank you so much for cooperating with me, okay?